On the CANSA Couch with Megan and Kutsai.
Good day, everyone, and welcome to On the CANSA Couch. I'd like you to introduce you to my co-host, Kutsai. Hello, Kutsai. How are you today?
Hi, Megan. I'm good. It seems these days we're always matching some colors some way, somehow. Nice to see you.
So glad to see. But as you can see, it's chilly, and so we're all nice and red and bright colors. And it actually gives me great pleasure this month because we're shining the spotlight, in actual fact, on something that doesn't always get that attention as we now know, and also deserves, and that is men's health. But I think it's also important, to know that we often see men and they'll go and do what they need to do, like service their cars and make sure that they do that regularly, replace the tires. And we know, no one's going to miss a rugby match with a boxer playing. But the same should be going for our own health. And men should be looking and not waiting for something to go seriously wrong before they reach out and check their health. So let's have a look at that today because it's such an important topic.
Thanks, Megan. And that's why today's conversation matters. We're going to talk about prostate cancer, testicular cancer, early detection, and one of South Africa's most iconic men's health awareness events, the Hollard Daredevil Run. And I would like to introduce our first guest. Our first guest is Dr. Donnie Fick, a Johannesburg-based GP with a passion for helping people live healthier lives. Dr. Donnie is based here in Johannesburg, and he's a key opinion leader for L'Oreal Dermatological Beauty, Novo Nordisk, and Reckitt. He partners with leading global brands to educate healthcare professionals and the public on topics such as dermatology, men's health, metabolic health, and preventative medicine. Beyond the consulting room, Dr. Donnie is a trusted health advocate, sharing practical medical insights across social media and is a regular voice on 5FM and Nando's Hitwaves Radio. When he's not talking health, you'll find him logging kilometers on the road as he is an avid marathon runner, or he'll be hunting down the next pair of sneakers as he also really is into the sneaker game. Welcome, Dr. Donnie. It's a pleasure to have you back again with us on the CANSA Couch.
I was so excited to be here. I think it's such an important topic. As men and as a man over 40, this is so important to healthcare and preventative medicine. So thank you very much.
And I'm very excited also to introduce you to our second guest for today, Adele Creel. Adele, welcome. Adele is the head of experiential marketing at Hollard. She's responsible for creating meaningful brand experiences that connect people to Hollard's purpose and strategy. And she has nearly 3 decades of experience in marketing and brand management. Adele leads the planning and delivery of impactful events, conferences, hospitality experiences, roadshows, and stakeholder engagements across the business. Known for her collaborative leadership style and a passion for people, Adele focuses on bringing Hollard's culture to life through experiences that inspire connection, celebrate achievement, and create a lasting impact. Adele, welcome and thank you for joining us today.
Morning, Megan. Thank you for the welcome. It's lovely to be here.
And to jump right into it, and can I start by, Dr. Donnie, asking you, so let's talk about men. You work with men from all walks of life. Why do men often ignore these symptoms or any symptoms or avoid going to the doctor, even when something doesn't feel right?
I think it comes down to stigma. From an early age, men get taught not to talk about their problems. Just generally, you should be strong, you should push through it, toughen up and deal with it. That's kind of the mantra we were all raised with. And I think we've shamed genitals. I think we don't talk enough about male sexual reproductive organs and the risk entailed with that. I think women have done a good job in talking about breasts and breast cancer, but no man ever speaks about these things. And I think it starts as a kid. You get given different names to, you don't call it a penis or testicles. You get given other names to mask the anatomy. And I think we need to break down the stigma. I think we need to use the right language, and men just need to talk about it more.
I can't agree with you more. And I think this is something, hopefully, that will open that door to, particularly parents speaking to the young sons, where it is something that is discussed more often, so that it becomes an easy topic and something that we know we need to take care of.
Definitely.
So, Dr. Donny, as you say that there's stigma around talking about male genitalia and men's health in general, what would you say to a South African man listening right now? What would you want them to know about prostate cancer and testicular cancer? And beyond that, what conversations should men be having, especially, like you said, these things start from childhood where men are taught to say, to represent something with another word, or so what conversations should fathers and sons be having about men's health?
I think the one thing that I say to me in South Africa is prostate cancer and testicular cancer is not a death sentence. And the most important thing is early screening, early detection, and early treatment saves lives. It's as simple as that. I feel like that's the only thing I want to say today is like, if you get it caught early, the survival rate's much, much higher. And it comes back to like habits as like parents and their children, like caregivers need to show their sons how to check for testicular cancer, how to do self-examination. Testicular cancer is historically a cancer that's more prevalent in younger men. So we need to be open to talk about these things, show them how to test for lumps and bumps in their testicles and how to have the balls, no pun intended. And this is why I love this Hollard Daredevil Run. Have the balls to talk about it. Have the balls to put your hands up and go and seek help. Because the earlier we get it, the better the survival.
Absolutely. And what you've also, when you mentioned all of this, is how today, as women, there's lots of literature, there's lots of, information that gets sent out, how we can check in terms of, for breast cancer, but we don't really see something like, checking for, for testicular cancer or for any lumps and bumps. So that is something that really also needs to become more front of house, and people need to understand it's something that needs to be done on a regular basis. And before asking something about that very important Hollard and our purple Speedos, I wondered if I could ask you about, when we are checking or people do check, how would they know how to check? Is there something that they can find? Do they go to their doctor? Does the doctor help them to ensure then this is the best way to check? Would that be a good one?
I think it starts at home. Like similarly to women, like where breast self-examination became, everyone knew how to do it. You use the palm of your hand, you feel in the 4 quadrants of your breast. And men need to also just feel their testes, like in between your thumb and your index finger. Just feel for any sort of lumps or bumps. We say anything that feels gritty, feels abnormal, you should go and see a doctor, and they should then investigate that further. But if you've got pain, swelling, discomfort, anything in that area, it should be further investigated. And I think it starts at home with self-examination, similar to what women do.
Oh, no, that's very helpful. Thank you for that. And, now jumping in, because I'm excited about these purple Speedos that we've been speaking about. And so with the Hollard Daredevil Run, it has become one of South Africa's most recognizable awareness campaigns. And this is very exciting. So thanks to partners like Hollard and everyone who takes part in the Daredevil Run, CANSA is able to continue providing awareness, education, screening, and support services to all men across South Africa. So, Adele, can I ask you, how did wearing purple Speedos become such a powerful way of getting men to talk about their health?
Yes, Megan. Wearing a purple Speedo isn't just about having fun. It's about making a statement. So seeing thousands of men running in purple Speedos immediately catches everyone's attention, and most importantly, gets people talking about it. Whether you see them in the flesh or in the media, this campaign uses humor and camaraderie to break the stigma that may exist around testicular and prostate cancers. So by daring men around the country to step outside their comfort zones, the Hollard Daredevil Run makes it easier to start the conversations that some would otherwise avoid and spread the message that early detection saves lives.
Wow. Adele, do you think the Daredevil Run has changed the way South African men actually think about their health?
Oh, absolutely. Over the past 17 years, we've seen the conversation around men's health shift. So when you see the thousands of men proudly wearing their purple Speedos, that little Speedo, yes, it sends a powerful message that looking after your health is normal and something to be encouraged. Because this more men are willing to speak openly, ask questions, and take action. Well, there's still work to be done, and I do think that the Hollard Daredevil has helped normalize the discussions around prostate and testicular cancer. So every participant who wears that iconic purple Speedo sends a powerful message that looking after your health isn't a sign of weakness. It's something to be proud of.
100%. Thanks for that, Adele. And Dr. Donny, from a medical perspective, and I see you are showing us your Speedo, would like you to show it again.
I be with Adele, like either one thing is like these awareness campaigns change the narrative, right? I think it starts a conversation, changes conversations, and in time it changes attitudes as well. Like I think the bigger picture is over time, over 17 years, the conversation, thanks to Hollard and these Daredevil runs, the conversation has changed. 17 years ago, men weren't talking about their testes, they weren't talking about their prostates. So I think it's got two arms. Yes, for men to ask questions, get them answered, know how to screen, know where to go. I think that is also important. Like lots of men think they have to go to a urologist. They have to have a digital rectal examination or a finger in the prostate up the bum. Many men are then scared of that. However, there are different modalities that can be done, like blood tests, etc. So I think just answering some of those questions and showing them where to go helps them. But the longer term picture is changing the narrative and changing the attitude towards men's health. And I think Hollard have done a great job in 17 years in doing that.
From my side, I was actually just thinking, Adele, if I could, basically put the spotlight back on you, is why would you recommend someone join the Daredevil Run this year?
Let's face it, it's really fun. As Dr. Donny said, he's already got his Speedo ready for this year's run. But more than that, taking part means doing something meaningful, both for those who are participating and for the others. By joining thousands of South Africans across the country, united for this important cause, these daredevils are raising funds for cancer and the Prostate Cancer Foundation so that they can broaden awareness, educate people, do the necessary screenings, and support programs to thousands more out there. So it's really as important to make a real difference as South Africans and standing together.
And I think men love solidarity. Like we love team sports, we love rugby. And I think coming together on a day like the Daredevil Run shows solidarity, that we're in it together as men. And like men love this expression, leave no man behind. And on a Daredevil Run, that's exactly what happens. We leave no man behind on the road, but in life as well, that we're in this together. We show solidarity for those that are battling cancer. Standing with it, I think is such a big sign of support. But also like, I'll hold your hand proverbially and you can go for this test. I'll support you in going to get screened. I think women have such a good womanity around testing and screening. And I think men are starting to develop that as well.
I'm so glad you brought that up because in actual fact, Dr. Donny, I have two friends or girlfriends and they supported each other. The one needed to go for a colonoscopy and didn't want to go on her own. And my other friend said, I'll go with you. And the next thing they both went and had a colonoscopy. And you're not going to believe this. The friend that actually went to support the friend got a call back to say she needed to come in and there were things that they needed to take care of. And there again, I think sometimes just, being there for each other and like you're saying, leaving no one behind. And in this case, leaving no man behind is we can support each other because we know these things are, it's normal for us to check these things. These are things that should be part of our daily lives, part of things we do regularly. And in saying all of that, just from a doctor's perspective, why do awareness events like that actually save lives? Yeah.
I think we touched on it a little bit as well. It's what Adele said. It's about changing long-term narratives, changing long-term conversations that men feel more and more comfortable in getting checked. And this is the most important take-home point. Early screening, detection, and prevention saves lives. It's so much easier to manage a stage 1 tumor than it is a stage 4 tumor that's metastasized. So that would be my takeaway. These things really carry such weight and such significance, not just in the immediate screening, but changing healthcare narratives and dialogues for generations, I think.
And I agree with you, that whole thing about, the sooner, it's picked up, the sooner something can be done. And then what is the actual biggest myth about prostate cancer?
That it's an old person's disease, I think. Lots of people think prostate. Whenever I think prostate cancer, I always think Desmond Tutu. I don't know why in my head those two are always married forever. And that's also part of where the myth comes in, that we always think it's an older man's disease, that we need to be late in our 80s before this happens. It can happen to young people. I get patients here in their late 30s, early 40s that have been diagnosed with prostate cancer. So you're never too young to get checked. Especially if you have a family history. I think that's an important thing as well.
And may I ask you, what age would you say a person should stop checking?
So I think this very holistically, right? I think from the age of 20, you should go and chat to your doctor, even if it's once a year. Touch base, get checked out for sugars, cholesterol, blood pressures. And then as you get older and build that relationship, we start tagging more and more tests onto that. And what makes that beneficial is we've got like so much data. We can monitor this graph of where your health's been over time. So it's never too early. I'm not going to say you need to get a prostate check at age 20, but it's important to get into the healthcare system so that we can pick up anything earlier.
Thank you. That's really good advice. And Adele, now just back to the Hollard Daredevil Run. So for someone that's never taken part before, what would you advise or convince them to register and how to go about it to be part of all this?
I just would like to say, just do it. The Hollard Daredevil Run is about starting important conversations around men's health. Dr. Donnie spoke about it, and making a real difference in people's life. It's fun, it's meaningful, and a simple way to be part of a movement that creates awareness, drives action, and support a great cause.
It's just do it. And I think that message can be carried through, like, just go for the screening test, just put on the Speedo. It's scary. The first time I did it, man, like just being there with so many people in a Speedo is a very scary place. It's a very vulnerable place. And I think that speaks to where men find themselves in healthcare. Very scared and very vulnerable. But if you can take that first step at the Daredevil Run, you can take the next step in going to get checked out.
And like you said, grab a friend and do it together. And you all know, then you're both feeling, you can kind of share that. Okay, guys, let's be tough here. And we go and do it. And, it has all the benefits that go with it, where you're actually doing that whole team thing and for such a great cause. And in terms of these purple Speedos, we know we love them, or we really love them. And I'm going to put you both on the spot and just ask you if you both would think of one word to describe the Daredevil Run. And Adele, maybe you can start. What would you say that word is?
I would say powerful.
Awesome. Dr. Donnie, and you?
I'd say brave.
Yes. Thank you. Brave and powerful. I like that.
Thanks so much, Dr. Donnie and Adele. And I just want to go back to what Dr. Donnie said about the screening. Actually, that men are scared, they are vulnerable, they think it's, invasive, where, they're getting the finger test. So I just wanted to repeat that again for our viewers, that aspect, so that they know that it's not a scary situation, that there's a blood test actually available. Because I'm thinking maybe this is what drives most men away from the screening processes, because they don't want that sort of invasive finger test procedure. So please just repeat it again for our listeners so that they know that, no, that's not actually what happens. And then you can just describe exactly how that screening goes for the listeners.
So there's a blood test called a PSA, a prostate-specific antigen, which can be a marker used to detect early signs of prostate change. At some stage, that you will need a digital rectal examination. That's always going to be part of the screening. Doesn't necessarily have to be the first step, but at least if the blood test is the first port of entry, at least we have you in the system with not something as invasive. But as a man getting older, and it is a privilege to get older, at some stage you will need that digital rectal examination. But Also, you don't always have to go to a urologist, which might be difficult to get an appointment. It might be inaccessible from a price point of view. Go see your primary healthcare physician as well to help you with that.
Thanks so much, Dr. Donnie. I think that makes such a difference for people to know exactly what happens, what to expect, where to go, and how the procedures actually work. So in closing, I just want to ask both of you, Adele and Dr. Donnie, if every listener remembers something, just one thing from this conversation today, what would you like that message to be?
I think I want to reiterate our campaign line, and this is a fun way of driving our message out there. So our campaign line says, "Lack of balls, lack of life."
And I think the Hollard Daredevil Run reminds us of that courage once again. And it isn't just about putting on that purple Speedo, which is in itself, takes a lot of courage. It's about deciding to make health a priority. And I think let's also garner support from our friends, because I think everyone is like, Adele and both Dr. Donnie have said, they might feel a bit vulnerable, but in a group, in a team, there's strength and there's camaraderie. And so garner all the support from your friends, get them there, start this, and each year maybe set yourself a target. We're going to invite another few friends so that you can see this grow, and that we can make it a little bit more important and something more comfortable to speak about. Patsai, what do you think?
I'm so excited. I can't wait to see all the guys out there in their purple speedos and see them run around. That's really just exciting for just, entertainment. But honestly, I think we want to encourage the men. Talk to someone. Know your body. Get checked. It's okay to be vulnerable. And if you're feeling brave, we will see you out there in your purple speedo on the Hollard Daredevil Run. Thank you so much for joining us.